I'm at McLaren Port Huron Center for Sleep Medicine in Fort Gratiot across from the Birchwood Mall, and I'm speaking with lead technician Mark Buckley. Mark, thanks for joining us today.
Thank you for having me.
I understand that the center has received an accreditation from the American Academy of Sleep Medicine. Could you tell us how that accreditation differentiates this center from any other center?
Sure, you would want a center to be accredited because it basically lets everyone know that we're the gold standard. We're doing everything exactly how we should be doing it.
Now, I understand also that the center has been in operation since 1991. Could you give us a little background and history on that, Mark?
Sure. When we started out, we were one little bed in the hospital, and we really did not realize how big the need was until, whoa, we need to expand. So within the same year, we became 2 beds, and then by 2000, we were 4 beds. And then by 2006, we had to move out of the hospital because we grew to 6 beds.
It sounds like a lot of design thought has been put into the design of this facility. Do you agree?
Oh, yes. When we moved in here, we kind of had a clear slate, which was kind of really neat. So we could design it from the ground floor up. And my boss, Chris, went out and she looked around at other centers and picked out the best of all of them. And we basically designed it sort of like a racetrack, so you're able to reach the patient in a matter of seconds.
What types of treatments do you perform here at McLaren Port Huron Center for Sleep Medicine?
Well, we're comprehensive and we diagnose and treat several different sleep disorders. The most common one that we see is obstructive sleep apnea. But we also diagnose for narcolepsy and insomnia, restless leg syndrome, REM behavior disorder, and so on. I mean, we do it all. We also we're the only center in the area that sees pediatric patients as young as 5 years old. We do specialized testing for patients who are seeking MDOT relicensure, and we also do home sleep testing.
If a patient coming in here for an appointment is scheduled, what should they expect on arrival to the center?
Well, when they come to the center, they'll be greeted by our secretary, and they'll sit in our waiting area, and then they'll see the doctor, and the doctor will give them a brief, go over their history, sleep history, give them a brief physical, and determine if they need a sleep study or maybe they just need to work on something.
Could you also tell us, Mark, when a physician diagnoses somebody for sleep apnea or whatever the case may be, what then happens? Do they come here directly?
Yeah, when you initially, like I said, when you come in for the consultation, he'll determine if you need a sleep study or not. You'll come in for testing. If it shows that you do have obstructive sleep apnea, we would bring you back for another night and basically make sure we get the positive pressurized treatment on you. And then after that, the doctor will pick the best pressure from the pressures that were tried on you that night and then go from there.
Well, it sounds like someone coming here would receive treatment in a really nice, relaxed, private atmosphere. So I'm sure that you feel that this is a really great benefit to the community to have the center.
It really is. And it's very comfortable. I mean, as soon as you drive up to the center, it's just steps and you walk right into the sleep center. The rooms are very comfortable. They have a private TV, private shower and bath, a fan in case you like a little white noise or a little extra cool, but you can also adjust the temperature on the wall. They're sort of like little mini hotel rooms.
Mark, thanks so much for sharing all this information with us today. I really appreciate you joining us, and thank you again for being available to let the community know what we have, what a treasure we have.
Well, thank you. I do want to remind everyone we do home studies, and they're the newest thing that are coming out, so don't hesitate to give us a call.
Great. Thanks, Mark.
Thank you.
This is Sarah Tate reporting for McLaren Today's Health Program.